Welcome. My next guest, Rachel, had been dealing with anxiety issues and also insomnia. So she was a difficult case I saw, but with treatment, she really has come a long way. So I wanted her to share her story with you today. Anyways, Rachel, thank you so much for coming on the show. We really appreciate it. Tell us, what brought you to see me? Tell me about your history. What went on in the past and what led to for you to start seeing me?
Yeah, absolutely. So, let's see. I am 29 years old currently now, but I started with panic attacks and anxiety probably at the age of 22, 23. So I started on a medication called citalopram way back then. Um, it worked for a few years. I felt like I finally was able to get my panic attacks under control. So fast forward a few years, I was doing really well. Panic attacks were gone, except the anxiety was still kind of roaming. And I think as you get older, especially in your 20s, later 20s, the anxiety kind of like sparks up again. You just got a lot on your mind, lots of things to kind of figure out. So I started struggling with anxiety once again. No panic attacks still, just couldn't really shake the feeling of, just feeling like I was kind of on edge a lot, just not myself. So actually one of my girlfriends goes to Dr. Corona and she referred me to him. And I think I came, correct me if I'm wrong, back in January. So it's been about 6 or 7 months. And I've been on a new medication called Prestique and I absolutely love it. I feel like anxiety just never goes away, but with this medication, I feel like it has. So I haven't had really any struggles since then. I do have flight anxiety, really, really bad. Have yet to be on a plane with this new medication still. But I would say my day-to-day levels of, feeling anxious or just, like I said, kind of on the edge has definitely went out the door. My sleep, that has been the biggest thing. I was a terrible sleeper before. My anxiety would always hit me at night. So I've been sleeping at least.
You find with sleep, it was more problem getting asleep or staying asleep?
It was a little bit of both. Going to sleep was a struggle, but staying asleep was also a struggle. And now I still have like some time, like hard times just getting myself to go to sleep. But once I do, I probably sleep 9 to 10 hours, which is pretty unheard of for me. Even my boyfriend's like, are you okay? Like, why are you sleeping so long? Because I remember I had asked you, I was like, is this like part of the medication? And you were like, no, this is your anxiety just going away and me not realizing that had a big deal to do with it. So yeah, I have had no complaints. Medication was so easy, no crazy side effects. Yeah.
You had been on citalopram, which is Celexa.
Yes.
You were on that for a few years?
Yes, I was on that for a few years. Didn't love the beginning stages of it.
It made you nauseous, right, at the beginning?
Yeah, it made me really sick.
Yeah.
Especially like, and I wasn't like a big drinker, but I would take it at night. And if I had, a glass of wine or just anything, I would feel like I was going to get, sick or whatever. The beginning of it was, those 2 weeks they tell you, you're going to have kind of these mood swings, kind of like some deep thoughts. Didn't love that part. I was extremely tired as well. But once I got adjusted to it, it was fine, but I had to really be careful with alcohol. So I just didn't love it. It really did help the panic attacks, and that was the biggest thing. I just didn't want to deal with that. But in the end, compared to Prestige, it's like night and day.
I think also you had shared with me that you were having like neck and shoulder tension and
Yes.
back aches.
Yep.
Tell me about that.
I wasn't sure at first if it was, because I work in an office and I'm always like this. But once I talked to you about it, I kind of was like, ooh, this might be actually more, there might be more to it. And I mean, I probably had neck pain, back pain, for a while up until I came to you. That's all gone away. No neck problems, nothing. Yeah, nothing at all.
That's amazing. That's great. And you're on just the one thing. I mean, well, you're on the best medication on the market, and what I believe is the number one best medication. It's the number one medication I prescribe in my practice too, for a reason. Because it's the most complete medication as far as, anxiety, depression, physical symptoms. That's what really I've seen over the last 30 years or so with working with this class of medication is the physical symptoms, the sleep improvement. It's more complete than the SSRIs like citalopram you took before. Unfortunately, that's what most doctors know, and that's what most doctors prescribe. And most doctors never get to Prestige because they just don't understand the difference, or they just don't have experience with it, and they just don't do it. And so a lot of people are left with just okay result, better than nothing, but not great,
Yeah.
So
that's basically how I felt. I felt like it was, again, it did the trick. It got rid of the panic attacks. But after that, I just kind of felt not numb, but just not me. It was weird. It was definitely a completely different experience than how I am now. And one thing I meant to add too was I bite my tongue not my tongue. I bite my lip constantly before all of this, because that was a big anxiety thing. I would pick, scabs or kind of gross, sorry, but like pimples, things like that. Don't do that anymore either. Every now and then I'll catch myself, but it has nothing to do like with how extreme it was before. So another thing to add there that I've definitely noticed a huge improvement on.
Yeah, I talked to a guy earlier. He used to bite his nails, pick them. He used to pick at his cuticles, bite his nails. He doesn't do that anymore. Some people they pick at their hair or try to. Some people get eczema of the scalp, and then they pick at it, and they pick scabs, and some people actually pull hair. Some people actually pull hair out, and then you can see hair on their fingers that they pull out. So there's a lot of really nervous habits that sometimes if you calm the anxiety, it's amazing how a lot of these things can get better. A lot of these habits can get better. So
it's really cool to see, for sure.
Yeah, what it does is it puts you in control now. So the anxiety is not controlling you anymore. You're in control of the anxiety. So and this is really the real you. This is the real Rachel in my mind is you in a balanced state like this. And so. But anyway, I really appreciate you coming on and sharing your story. I think a lot of people
absolutely. I owe it all to you.
Really see people like you and really get hope that, hey, you know what? I have a similar situation like her. Maybe there is help for me yet. Because, again, a lot of people who are out there who get stuck on a subtherapeutic or, a medication like this, citalopram, lexaprazole out there, and they're okay. They're not bad medications. But the problem is often they're not complete, and then they can be kind of numbing,
Definitely.
And some people will say, well, I'll take numb over anxiety. Okay, well, that's fine, but it's not. We don't have to give that up. It shouldn't be one or the other. It shouldn't be numbness versus anxiety. It should be getting rid of anxiety without the numbness, and that's what something like Prestige will do. So anyway, but thank you so much for coming on, Rachel. Really appreciate it.
Yes, thank you. I appreciate it as well.
All righty, take care. Today we're going to finish up with my interview with Alissa. Again, a patient who is near and dear to my heart because she's been my patient for 22 years. I hope you enjoy it. So then, what was the next medication that worked for you? The Lamictal?
You added the Lamictal. I decided that I was very, very happy when I moved in with my now husband, and I decided I didn't need medication anymore. I think I was 22. And I lost my mind. I was throwing, it was just a really, really bad, they had to call the police. I was in college hospital for a while. Like it was just, and when they finally let me out, you added the Lamictal, and that was when everything stabilized.
Yeah. And Lamictal it's an antidepressant. It's a very unique one. It works on GABA. But it actually is also a mood stabilizer. I think the combination of lamictal, cerebral, Prozac. So you got serotonin, you got dopamine, you got GABA. I think that's why when I mix things together, you got to get a complete combination. I mean, it doesn't take away all anxiety. This is why sometimes things like alprazolam or Xanax is still needed here and there. Now with ADD, you probably always have had it, even when you were a kid.
Mm-hmm.
Now, it doesn't always come out because you're extremely intelligent. Okay, you're very smart. So when kids are really smart, you can't really tell. Now, the kids that aren't so smart, you can tell because they can't do their homework. They're getting terrible grades. You probably, I'm guessing, had good grades right now.
No, actually, my therapist less than a year ago was the first person that told me I was intelligent. She's like, "You're very intelligent." And I said, "I am."
Well, I've known that since I first met you.
Well, I mean, my parents never told me I was intelligent. I got by. I didn't get bad grades, but there was nothing special about me. I was just.
So kids who are intelligent, sometimes you miss they don't look for it. So they're looking for kids who are getting up and down. They're getting in trouble with the teachers. They're in everyone else's business and they can't sit still. Or kids who just cannot focus. It's obvious, but so sometimes it starts there, but it's very commonly it doesn't get treated. There's a lot of kids growing up that should be treated that aren't, and that's just reality. And a lot of people like yourself, it's going to come out more in adulthood. Sometimes it doesn't come out so much in grade school, maybe a little bit in high school, then more in college, and then if you go to graduate school, even more. So sometimes every level you go in schooling, if it gets the more and more difficult it gets, the more it's going to come out. And and in my new book, the Corona Protocol, I have a chapter on ADD, and I tell a story. I tell three different stories in that chapter actually. And one of the stories is about a woman who is actually a true patient of mine, who she got straight A's growing up. She started faltering in high school. I put her on ADD medication, straight A's in high school. She went to USC, which is where I went. Go Trojans. And
my best friend's not going to like that.
Right on. And I didn't hear from her again for a couple of years. So her story is that, I went to school and I thought, I don't need this. I got into my school of choice, my dream school. I did great in high school. I don't need to take this anymore. I'm fine. So she stopped taking it, and then for the first time in her life, she started getting B's and C's. And so, but she kept studying, and she told me later on, I was constantly in the library and studying. I didn't have a social life. I didn't have barely any friends, and I couldn't get the grades. And so she finally comes back to see me like in her junior year, and said, "Okay, I think I need your help." And I'm like, "Well, where have you been?" I figured, I told her, I thought you maybe saw a doctor up in LA. Maybe that's why I hadn't heard from you. Mm-hmm. I go, "It's not a weakness of your character. You're obviously smart. I mean, it's not about smart. It's about the fact that you can't focus, and you're all over the place, and you can't sit down and actually just do the work like that." So I put her back on her AD medication. She started thriving again, started getting her A's again. And thankfully, in her case, she ended up getting into medical school because I told her, look, if they see that junior, senior year where it's more difficult that you're getting the grades are picking up, they're going to look at that kindly. And thankfully they did. She got into med school. But had she not taken it and not come back to see me, she may not have made it into med school. She may not have become a doctor. She may not have gotten her dream profession only because she thought of a pride thing. Like, I don't need to take this, So thankfully she did, and she's doing great now. But ADD treatment is very misunderstood. A lot of people think it's like, well, just try harder. It's a weakness if you just hunker down, and just not true. And as you know, with treating it probably has made a huge difference in your life.
Oh yeah, I've had mixed. My therapist was really worried. She said, and this is just, he's going to trigger you. And I said, I'm actually at a place in my life. There's a lot happening and a lot of triggers going off. So this isn't, I'm very emotional right now, but you got me at a good time because it's not sending me, backwards, and I'm kind of going down, which is why we talked before we got on camera today, and really struggling with a lot of anxiety. It's just it's crippling, and it is horrible. It's like every day it's hard to take a breath, and there's no relief. And I'm going through a situation where I'm having to essentially divorce my entire family, and I have to do that because I can't put up with people burying their head in the sand about things anymore. And, anytime I've, tried to, talk about like, hey, mom, dad, why did this happen? I mean, it just gets met with just, denial, and, they get angry, and, obviously, being, there being 6 of us, each of us had 6 different experiences with my parents. One of my sisters thinks they walk on water, and my other one doesn't. And there's a lot of, I don't know exactly, what my siblings, if they've gone through similar things. We don't talk about it. I talk about it. So I've always kind of been like the black sheep of the family. But, recently there was a court case that one of my sisters, who I was very close with, she got a little bit obsessed with a married man and got caught on his ring camera. And I got subpoenaed to identify her on that. And I reached out to my entire family because all of us knew it was her. And I said, you guys, this is not normal. What is going on with her? We need to step in. And it was a group text, and all I said is like, so-and-so left the conversation. So-and-so left the conversation. So-and-so. I'm just like, oh my God. And then, there was some issues that was very concerning with my nephew, and I tried to bring those up. And then, since I was on the other side of the court case, my parents showed up in favor of my sister. And that just sent me, and that's not the reason that I'm choosing to cut them out of my life and not let them back in. I mean, it's, there's a lot of other things, happening that I found out about that's being uncovered now, because once you, I don't know how to describe it. Trauma gets, seeing my parents, for 2 years or a year and a half, every couple months in court, sitting by my sister, not talking to me, cutting me out. I'm just sitting there like, it's her. I mean, that's why I'm here. It literally, if the feud was going on, it was between me and my sister, not me and my siblings or anybody. And all of them just are like, they just ignored me. And it broke my heart. It still breaks my heart. And I realized that I just got to wipe everybody out. I can't do it. And then, possibly down the line, if they come around, it's going to be like a case-by-case basis. But at the moment, I have never been more closed off in my life to people. Which is why, my anxiety right now is so, it's never been this out of control. And like I said, we talked about that before. And so jumping back, because now my ADD is kicking in, jumping back is another reason that I'm here, is because working in healthcare, there's a lot of stigma around mental illness. Nobody wants to talk about it. So people always come in for anxiety because that's an easy thing to say. Or I'm depressed, I'm anxious, but I'm looking at these people and I'm like, something else is going on. The internist will throw Lexapro and Zoloft at them, and that rarely works. And then, they'll, like I was saying before, it sometimes, not really sometimes, I'm reluctant to tell people what I take, because they Google it, and like Seroquel says antipsychotic. And, you Google Lamictal and it says anticonvulsant. And, you Google Adderall and it's like this stimulant, and people ask you for it because they think, oh, I want some Adderall. And it's like, no, it's a super pill for them. For me, I take it to function. I can't even drive without it. I've gotten into accidents because I'll look at something for a beat too long. And, and it's really frustrating also, going to internists because they look at the list of medications that you write down on the paperwork and they're like, holy crap, why are you taking this? And that's too much of that. And who's this Corona guy? And, I read about him and, his patient overdosed. And it's like, have you not given, as I even asked the doctor I work for, I'm like, he never said anything about you, but, I told him, I'm like, you give these people, you give people 30 Ambiens. Okay, how is it your fault if somebody takes all 30 of those at the same time? That's not your fault. That's their fault. It says on there, take it at, if it says take all 30 at the same time on the SIG, then yeah, we have a problem. But, so I just stopped going to internists altogether because they just like, they were reading this and like, I have no idea what you're crazy kind of a thing. And that's when I kind of reached out to you and I said, I'm not doing this anymore. I need you to, because my best friend's a PA. And so she kind of, she'll diagnose me and then I call you and I say, hey, can I get a Z-Pack? I gotta do it because I'm not doing it anymore. I hate it, and they always give me crap about you. So.
Well, and it's amazing, like how many internists, like you said, I don't ever bother with the thyroid medication, the diabetes medication, the blood pressure, whatever. I don't touch those things because that's what they do. That's not what I do anymore. But everyone wants to mess with what I do, and they're like, "Oh, you're on too many things, or you're not." Yes, of course you're not psychotic. That's not what I'm giving it to you for. That's not why I'm not giving you Lamictal because you have a seizure disorder. I'm giving it to you because it's a mood stabilizer. So,
yeah, that changed my life. It changed everything.
And and we talked about before. I'm going to add a little bit more of a mood stabilizer. I'm not going to say which one. Okay, I don't want to advertise for a company right now, but I think I want to add a little bit of something I think to really lower the anxiety further. It's in the family of Seroquel, but it's really excellent for the residual anxiety that you're going through right now. I think it's going to help you quite a bit. But, as far as this whole thing about bipolar disorder, because you don't have the classic history of that, the most common reasons for getting it is, number one, genetics. But it's hard to retrace that with family because your dad's an alcoholic, your mom is, I understand, a narcissist, and she sounds like she's quite a piece of work. So there's stuff going on.
She's very intelligent, though.
Yeah. So
it's scary.
Yeah. So you got it from her. So, but so you have genetics. You just don't know about it. If you probably look at your siblings, your cousins, your aunts and uncles, you're probably going to see some family history there going on.
Yeah, now that I'm.
Yeah.
Kind of
second factor is hormonal changes. So when else are times puberty? You went through very early puberty. Premenstrual, postpartum. So sometimes during hormonal adjustment changes, mood can really go off track. And in your case, trauma. So you went through some really over-the-top severe trauma, sexual abuse of a kid. Of all the things I see in my practice, probably the worst and most traumatic is what you went through. There's not really a close second to that, being raped basically as a prepubescent, or actually, but you were very young, and and it's you can't. You can go through therapy. and you can help to get through a lot of it, but it's very difficult to get past that, you know.
Well, I always question, I mean, when I go through my, like I am, processing a lot right now, I tell my therapist, I'm like, why did he take my mind? Why couldn't he just why couldn't he just take my body and like threaten me or something? Don't tell me you love me. Don't tell me that we're going to be married one day. Mm-hmm. You're my fucking relative, Mm-hmm. I mean, obviously it's, women or girls tend to, fall in love with the first man that they, have sex with. And that's exactly what happened to me.
Yeah.
I mean, I thought for the first time in my life, oh my gosh, I've always been not getting my needs met. And here comes this man who, and I'm not even going to let you know what he does for a living and still does for a living because it's disturbing. He's walking around, with zero consequences. And, I'm over here, struggling at this point. Mm-hmm. And I've been struggling on and off my whole life. And I don't know if that's ever going to end. It's really hard. Yeah. And, especially.
Have you gone through EMDR therapy?
No, I was I'm going to ask you about that at a different time. So, no, that's something that I'm interested in for sure.
Well, EMDR, I can't remember what eye movement is EM, DR something, but it's something that you have to be a trained psychologist. Psychologists who are trained in doing it. It's something with a right brain and left brain, and you basically re-experience the trauma, but it's in a way it's the most effective for PTSD. It's the most effective therapy. So you really should look into that. I mean, I know you have a good therapist, which is great. But if she doesn't do EMDR, you should get referral just to get that done, because I've had patients who've gone through severe trauma, rape, near murder, near death, witnessing murder, really severe stuff, and they get a lot better with EMDR. I see a lot of veterans. I'm going to do a show soon on PTSD. I see a lot of veterans from like Vietnam War who suffered horrific things.
Oh yeah.
And they 50 years of suffering, and they go through that therapy, and it's a dramatic difference. I mean, with those guys, medications it's really satisfying treating those guys, because after 50 years of suffering and a couple visits or so, I can get them feeling way better than they have in 50 years, and just with simple medications.
Yeah.
So it's really satisfying to see those guys, but then you get them in the right therapy, it's even better. Mm-hmm. And so, so that's something you definitely should get involved with. But
I just, my trust issues are just out of control. So unless it was somebody that you knew personally or my therapist knew.
I do know some.
Okay, I would take a referral. I don't trust anything right now. There's like 5 people that I trust.
I know exactly who I'm going to refer you to. She's wonderful. And I think you get along really well with her too. You guys, your personalities are very similar, so I think you'll like her a lot.
I think my personality is the only reason I'm alive right now. It's a lot. And I don't know, I just, like I said, I mean, I just see so much, especially nowadays, so much undiagnosed, or maybe diagnosed, but then, especially like in men, mm-hmm. I don't know if I said this when the camera was off, but, men, they get on, the right treatment, they feel wonderful, but then they realize that, have, erectile dysfunction. And apparently that's a big thing for men. I don't understand it. Yeah, women don't understand it, but my husband's like, it's a big thing.
It's a huge thing for men. And the thing about that is, there's ways of dealing with it. I mean, I'm good with meds, and you have to know what you're doing with meds, how to avoid that side effect. Mm-hmm. Or if they get really good results, but they get side effects, I'll add something like Wellbutrin, or I'll add something to the mix that knocks that out right away.
Well, that's good.
Because no guy is going to put up with that, and so it's going to, either we have to lower the dose, we got to change the medication, we got to add something else, but normally I don't let that go.
Yeah.
That's something that is
a big thing.
Is resolved. So.
Yeah, that's great. That's good. Yeah. I mean, and like I said, the people that I've sent you to, before I slip your name. I'm like,
Right.
are you ready?
Right.
Do you really want this? Because he's busy, and I'm not going to send you some
Right.
non-compliant person that's driving us crazy. I'm not going to send him over to you.
Yeah, but I enjoy seeing patients that are challenges. I really enjoy seeing patients that other.
Well, I do too. That's the thing.
That other doctors give up on, or other doctors don't know what to do. I love that because I love the challenge of that, and I love to see. And then even patients who are really resistant against, I'm really good at talking people into things.
Yeah, you are.
And so if I draw my diagrams and explain what the neurons and what I'm doing, I think most of the people who are really resistant will follow through. Not everybody. I mean, and there's people who will leave I'll never see again, and then they're lost to treatment. And that's the sad part is like that. If someone doesn't understand this and just stays, they'll never get better. They'll never get better the rest of their lives.
Yeah.
They're stuck there. Or if they go and see someone that get an SSRI that's the wrong one, they get erectile dysfunction, and that's it. They go, oh, I'm not going to go. And that you may never see that person again.
Yeah.
That might be it then. So yeah, but I like the challenge of complex people. I'm really good at combining, like with you. You're on 3 really good ones, but I think I'm going to add one more that's going to really, I think, turn the anxiety down.
I really hope so.
And and to the point where I think you're going to feel a lot better soon. So.
I'm pretty good because, as you know, I mean, even my panic attacks have been out of control. I'm getting really good at catching them. Yeah. But if you have a panic attack, there's no point in taking Xanax. You're just going to go to sleep for the rest of your life, for the rest of the day.
I think I'm going to have you back on, maybe on the speakerphone, call back in maybe 2-3 weeks so that you can, because I'm pretty sure what I'm going to give you is going to help. So maybe we can talk about that in a couple weeks on the phone, on the show. So, but anyway, I really appreciate you coming on and telling your story. I know it's difficult and.
Yeah, it's not easy, but
it's hard to talk about what you've gone through. It's hard for me to listen to it because I'm very empathic and when I can feel people suffering and I know that you suffered and
I'm suffering a lot right now.
I know you are, and so and I know I know we didn't share all the details here, but I know we talked about very difficult things you're going through,
sometimes I just am amazed that I'm awake and getting ready for work and just going and just doing what I do, Right. And I know that there's other people out there that feel like me and have gone through similar things or maybe worse. And, this is the first time in a long time that I'm truly suffering every day. I'm suffering lately, and I don't know how much longer it's going to go on for. I just want relief.
I know, and it's a saying that's I've heard of the saying you got to rise above your raisin.
Yeah.
I know you don't like raisins, but
I fucking hate raisins.
But this the term you got. You're rising above your raisin. You're rising above just a bad childhood experience, and it's trying. I mean, it's your parents. They were who they were, and it wasn't a good childhood. Not like they were beating you or
they weren't horrible people. They just
it's not that. It's just but just emotionally,
Yeah.
And basically causing the eating disorder early on with that's very common.
That was not cool.
Not cool. Yeah, and. So, but I really appreciate you coming on and sharing your story with us.
I look forward to trying the new stuff, and hopefully I can get some of this off my chest, heaviness, and stop having panic attacks on the bathroom floor.
Yeah, well, we're gonna work on that.
Yeah.
Thank you again.
No problem.
Appreciate it.
Of course.